Hi. Tonight I'm going to be exploring we had the option to do a bipolar disorder assessment, or we could look over the major depressive disorder video on Canopy. I chose to explore the major depressive disorder video. And so I'm kind of going to go back and forth on my screen. I'll read our questions and then I'll discuss them with you. Let me pull up my document. So the first question asks, what signs and symptoms did the client or therapist address that led to the diagnosis? They went over some of the DSM-5 clinical concepts of mental disorders involving there's 4 different groups of the type of depression episodes. And they presented for the case that the client in this situation had somatic symptoms of chronic depression, which was like food adversities, a lack of appetite, sleep disturbances or sleeping too much, suicide ideation. Some of her milestones had been interrupted because of her lifestyle changes due to the mood disorder. And then she also mentioned a lot of having 500 specific days of crying and created a subset of amount of days that this was a chronic depression and not just an episode that they could call it persistent. And that's kind of what we talked about in the video too, was kind of distinguishing the difference of a persistent depression disorder and a sorry, my mind went blank. Between the persistent one and the more severe one. And so with that's going to be with the persistent depression, the episodes are going to be a little more stretched out. But what was so alarming about this client was because while she was having some episodes still stressed out, she was still having these very serious depressive episodes. Some of her symptoms were her describing herself as being a prisoner of her own mind, living in constant fear and despair. She had hopelessness, lack of care to live, and she said that she did have some intentions of like wanting to commit suicide, but there wasn't really a plan. So it's kind of ideation, but she was also afraid that if she committed suicide, she wouldn't do that right. And so that kind of goes back into spiraling into, I want to do better and I want to be better, but I still have this outlier here, is what I hear whenever she's speaking. A differential diagnosis that I could consider with this client, I discussed a few, and I know that they did talk in the video about her having like an anxiety disorder prior to the major depressive episode, and that it was kind of they didn't say ironic, but they just mentioned that that was some of her first symptoms that she presented, as well as some PTSD, rocky, unstable childhood. There was some mention of alcoholism within the family. And I know that this isn't as talked about widely now because they do kind of consider it talking more about the major depressive episodes versus the shorter episodes. But I was reading into, sorry, I'm changing screens again. I was reading into, sorry, I'm learning how to navigate my screens back and forth. Looking into a diagnosis code for adjustment disorder with mixed anxiety and depressed mood. As I was reading a little bit more into that diagnosis, though, the only thing that I can kind of really see the major depressive being a better diagnosis is because of the maladaptive responses to stressors. The major life event could have been something from the childhood. It could have been like a failure to be able to adjust with that environment. Hence, the anxiety and the depression started within that. And now, because she's lived with that for so long, it's kind of just the depression that represents itself. So I would be curious to look into that. And then what if any comorbid diagnosis might be present? Explain. I think honestly, just a generalized acute anxiety would go along with this client due to the amount of anxiety stressors that she mentions having, which is kind of just interfering with her day-to-day life. And because those symptoms are not like spaced out like they are daily, like they would be an acute diagnosis. What specific techniques do you want to remember from this therapist style to use for your future practice? I do like how the therapist did use open-ended questions and kind of led questions talking about the different types of symptoms that the client could have been presenting. Excuse me. I see that that was a good tool to utilize because I think that it provided the client to distinguish some clarity between kind of how she was feeling and how these symptoms would appear and how she would act out on them versus it just being a generalized statement. I do like how the therapist explored more into that. I feel that by the therapist doing that, it offers a different insight to where the client is coming from versus it just being all about, their symptoms and how they're feeling and how they're acting. But whenever we go into that and we ask them, I think it was along the lines of, what else would you want us to know about this? It gives them a chance to maybe like speak and be heard because they've probably thought about these things a million times, but just not been able to process that through. I like how the therapist had kind of like built rapport, but um it wasn't too noticeable. I think she was just kind of like more of a safe like voice to bounce off back and forth. And sometimes I think a very like professional stance does help, especially whenever the client is already emotional about a problem that they've had for a really long time. And then the therapist also did something that I really liked in here. She acknowledged how hormones can be a very big effect for this client's like mental stability at that time. I believe that this is something that like is very undervalued when it comes to women and hormones and PMDD. I believe that they took that out of the DSM for a little while, but from what the video said, they've actually added it back in. Um, and so I too am for exploring how all of those factors can play a role in the seasons of our mental health. And then going back to something I said earlier, I made a note about it in this section because I believe the therapist talked about it at the end. She was talking about something called double depression, and I hadn't heard it like that. I do believe that we've kind of studied it along the lines. It's just been called something different. This is what I was trying to explain earlier when it said there was like the long days of depression, and then there's even longer, harder ones. And so the effects go from being like already having consequences to them just becoming more severe, hence like the double depression. I really liked how she broke that down because it kind of helped me see like, oh, there is like different levels to this. And I also believe that she used a strengths perspective, which is always a good empowerment tool to use with our clients. Um, I see that the client had quite a bit of growth from, their very first therapy session to where they are now, and that they were kind of like proud of how much work they had put in, but they also still had, the concerns of knowing that they do have a mental illness. What, if anything, would you do differently in this session to arrive at a diagnosis? This was briefly talked about at the end of the video, but it was talking about wanting to know the client's medication history and their history, like with the psychiatrist versus just the therapy route. And I too would be very curious to see if there had been any type of interventions made from the medical aspect as far as medication goes. And then also I know that like we kind of just saw like this first video, but I would be interested into exploring her childhood some more to look for any markers that maybe could have been missed out for abuse or neglect. I know that we had some substance abuse already mentioned. So I would kind of really want to see how, the relational theory could tie into her mental health and her self views and her values if this was something that could have been, from a learned experience. And so I would be curious to kind of dive into her history a little bit more with that. And then I would also want a substance abuse assessment. We didn't really talk about substance use in that assessment. However, I think working in the field as long as I have, like, that's kind of one of my first questions too um, is there any chance that we have outside factors playing into this? And it's great when there isn't any substances, but then it's also kind of scary when there's not substances because then it's like, oh, okay, so we've got to get in here and figure out, how can we break this down to help this client? And then I would also want to use like the depression scale tools just to kind of keep up with that on a more consistent level. I know that she talked about the different seasons that she'd had in her recovery as far as her mental health. I would want a consistent report to see if there is certain times of the year that these symptoms are worse. Are there certain stressors? Are they certain seasons? See if we could find any type of consistency with these patterns, or the lack of consistency thereof can be a tool to you to help us as well. Um, no, I think that is all that I would probably do, and I believe that that wraps up my questions for this assignment. I do hope that you have a good break, and I look forward to seeing you in our next class. Thank you.